Right. Well, I know we have just a handful of folks on, but and we may have some others join us. But we thank you for joining us, and we want to respect your time. We appreciate you taking the time here on a Thursday afternoon. Before I think a lot of folks are probably kind of looking at the holiday schedule, and so we appreciate it and look forward to being able to speak with you here today. Today, our guest is Chris McGovern. He is the director for research development at Connected Nation. We're excited to bring this sneak peek or what we're calling a sneak peek of the Bringing Healthcare Home follow-up study, which is a study that follows up to the work that was completed in 2020. Chris, are you there?
Yeah. Hey, Wes. Thanks for having me.
Yeah. Hey, Chris. Glad to have you, Chris. We'll go ahead and get started here in just a second. I don't think you've got your video going. If you want to, that's fine. But we thank you for all the hard work. I know you've been heavily engaged in this process in Michigan now for the past couple of years at least, and so I think you've seen some pretty interesting stuff. That we did have this thing called the global pandemic that happened in the middle of this, and so we recognize that up front. But I think it's also been a really interesting time to have the work going on that you've been doing. With that said, we'll go ahead and kind of dig in a little bit here. And we just have a brief outline for the conversation today. And Chris, I think the first thing we kind of want to look at is kind of the project history and how we got to where we are today and what this study entails.
Right. Yeah. Well, we've been working in Michigan for over a decade now. But as far as this project goes, it started back in 2019 when we partnered with AARP and Michigan Health Endowment Fund to look at telehealth usage in some rural communities there across Michigan. There are 5 counties: Dickinson, Gladwin, Osceola, Roscommon, and Sanilac, where we looked at them as representatives of different parts of the state. They have different employment makeups. You're looking at everything from the mining towns up in the UP to the beet farms over in the eastern part of the state. And we wanted to look at both the healthcare providers. Each of those communities is served by a different health network. So we wanted to look at what types of services are being offered or what kind of services were in demand over there. And then also we wanted to talk to households, see what their thoughts were on telehealth usage, see how many people are using those kinds of applications, and amongst those who weren't, what kind of things were preventing them from participating or using those tools. So that was in 2019 we conducted a household survey along with some extended interviews with healthcare providers in each of those 5 communities. And we looked at those numbers, compared them to some national averages, and in that we identified a number of issues that were real barriers both on the provider side and household side. Back then in 2019, early 2020, when we went to release our results, the idea was to come back and do some community meetings and talk about some of the things that try and address some of those issues that we identified. But that was when we released our report back in early 2020, right about the time that COVID hit. So that kind of put the kibosh on doing community meetings and big group gatherings. So instead, we ended up working with a company there in Michigan to produce some public service announcements that that helped. Well, the goal was to try and alleviate some of the concerns that people had mentioned during that first time around about using telehealth applications. Those PSAs, they ended up looking really sharp. We won some awards for them. And then what we wanted to do as part of a kind of a backside to that first study is do a follow-up and talk to households again to see, once again, if they're, how they're using telehealth, if they still have some of those same concerns, and then of course with COVID affecting so many healthcare decisions nowadays, we wanted to see just how much COVID had changed people's perceptions and usage of telehealth. So that's where we end up with this study, bringing healthcare home, based off of the survey that we did earlier this year, 2021.
All right, Chris, thanks. I think that's helpful, particularly as we begin to kind of frame up what, some of the things that we find, and then even to follow up there, what some of the recommended actions are that, that we see coming from that data. With that, what are some of those things? I think there's probably, if I remember, you and I were talking earlier, there's 4 or 5 really kind of key things that you had kind of found and wanted to bring some attention to.
Yeah, well, obviously, telehealth has really exploded in the last 2 years. We've seen that, nationally, and in these 5 communities, we saw that same story play out. Whereas back in 2019, about 1 in 3 households had said that they had used telehealth applications. When we did the follow-up survey in this spring, we saw that over half the households said that. We're looking at about 54% of households saying that they're using telehealth now. So, that explosion has been the result of several factors. Obviously, there's the safety element where telehealth tools has allowed people to see their healthcare providers without risking spreading the coronavirus. There's also been the fact that on the provider side, the ability to provide healthcare online, either through the internet or through the telephone. A lot of the regulations that had that restricted the reimbursement that those healthcare providers were able to receive for telehealth services, a lot of those were either dropped or loosened. Some of those regulation changes were temporary. Some of them were considered permanent. But those changes, back in 2019, the refrain that we heard from healthcare providers over and over again was that the biggest barrier to expanding their telehealth offerings was that they were not getting reimbursed by a lot of insurance providers or by the like Medicaid and Medicare at the same rates as they were for in-person visits. And so that created a real incentive to focus more on the in-person visits. But with COVID-19, that changed, and providers were able to get reimbursed more easily for telephone visits, for video conferencing, for those kinds of visits through telehealth tools that in a way that made it easier for them to provide the services, and it made the patients, it made it easier for them to actually use those tools. And yeah, you really see that in, we looked at the different types of applications that people were using. And like I said, overall, you had that jump from about 1 in 3 households interacting with their healthcare providers online, jumping up to over half in 2021. But in addition, or in particular, we saw that video consults where people would see their healthcare provider by using tools like Skype or video conferences. The use of that jumped dramatically. It went from hardly any households using it. It was in the low single digits, about 2%, and it jumped to 21% of the households that we had spoken with here this year. So, all of the services jumped dramatically, but that was one that really stood out. Those video consults really jumped in their usage.
Chris, if you don't mind me interrupting, were there, I believe you looked at ages, kind of age ranges. Were there any any insights from seeing increase in particular ages, or age groups, their use of the technology?
Yeah. Well, in 2019, we saw that that younger adults were typically the most likely to use the telehealth tools, age 18 to 34. And we saw that, that continued. Younger adults were most likely to use telehealth, but the biggest jumps came from older adults, those age 65 and older, whereas before about a quarter of those respondents said that they were using telehealth tools. Now it's about 2 out of 5, more than 40% who are saying that they were using telehealth applications. We also looked at different demographics, and one of the biggest increases we saw in our survey kind of mirror what has been seen nationally, in that telehealth tools have been used to a great extent by households with children. The percentage of households with kids at home who said that they use telehealth tools, it jumped to about 2 out of 3 of those households. So, and that makes sense. One of the biggest reasons for using telehealth applications over in-person visits is the convenience and the ability to, you don't have to get the kids packed up, lug them down to the doctor's office, have them sit around. All of that all those hassles can be avoided by telehealth usage. And so that's what we saw families doing, was using those telehealth tools, and using them to avoid those trips to the doctor, or trips to the emergency room, or the ability to follow up on visits that normally would have to have been done in person, and now they're able to do them online.
Sure. I think too, from an economic impact standpoint, there were some pretty substantial findings there, correct?
That's right. That's right. We looked at at the number of households that said that they were they said that using the telehealth application saved them or prevented trips either to the doctor or an emergency room. And so we wanted to get kind of get an estimate on what kind of number that would present as far as like a financial savings or an economic savings. And so, we looked at the the healthcare blue book, which gives some estimates about costs related to the doctor's visits themselves. We looked at some time savings based off of median household incomes there in the area, on hourly. And so what we found was that altogether, the households that said they were that they took fewer trips to the doctor's office, they said that on average is a little bit over 4 trips that had been saved over the prior 12 months. And so that, based on the number of households there in the area, that ends up being a little bit over 69,000 visits that were prevented or that became unnecessary because of telehealth tools. And when you look at the savings for the doctor's visits themselves, obviously, different visits or reasons for visits are going to vary in price. But just for assuming a conservative, simple 15-minute visit to a general practitioner, that comes up to over 13 million a year within these 5 communities. And then when you add on the time savings and the value of those hours that are spent traveling back and forth and waiting in the waiting room, that bumps it up to over 16 million in savings just for these 5 communities.
Yeah, Chris, that has a huge impact, and it's neat. I think there's a lot that we all anecdotally have seen and understand, because of COVID, and kind of just it's really kind of pulled the sheets back and made us look and recognize what's going on, behind that curtain. And so it's nice to have, some evidence, some research and some data to look at it and think about it, and to begin to really kind of build from. With that, what are some of the recommended actions that you had suggested through this report?
Well, based on what we found both this year and in 2019, like you said, it is obvious that that telehealth applications are having a major impact on on the way that we all see our healthcare providers. But also, as I mentioned, several of the regulations that designate how healthcare providers can see patients online, and what kinds of visits they're allowed to bill for. Several of those were set up as temporary relaxation of those rules, and those are liable to expire right now, based off of depending on how long COVID is considered an emergency situation. So one of the things that we highly recommend is, Connect to Nation Michigan. We're a very data-driven group, and so we highly recommend that a cost-benefit analysis be done of an analysis of keeping those rules as they are now. There is a continued demand for using telehealth applications. About 3 out of 4, I think, individuals said that they intend to continue using telehealth applications about the same as they are now. And another 5 or 6% said that they intend to use it more frequently in the future. And so there's definitely consumer demand there. But if those restrictions go back into effect, that could put a damper on that continued use. And so, we think that an analysis of how, what kinds of cost savings would be experienced across the state would be really important. And like I said, this analysis that we did was in a handful of rural communities. And so, expanding this kind of research and focusing on telehealth statewide would be really important, because it's not just people in rural communities who are using telehealth nowadays. It's folks from Dickinson County down to Detroit. And so doing a statewide analysis would be, I think, would provide a lot of insights that would be useful both to policymakers as well as healthcare providers.
Right. Well, I know one of the questions that's popped up here, Chris, was a question about where they could get the report. And so I guess the question is, when and where can we get the report?
Well, we are going to be going live with a report this afternoon. In fact, right there at our website, connecttoNation.org/bringinghealthcarehome. That is where the full report should be available. I do believe it is available at the time we started the webinar. So that has all of our findings. It has links to our initial report as well as to this follow-up one, including the methodology used and our recommendations. But Connect to Nation has been, we've been looking at telehealth for several years now. And so in addition to this report, there at that website, you can find useful information about national policies, telehealth language, different terminology, that's word, different terms that are used that are related to telehealth, and as well as both our original 2020 study and this one, which is just released.
That's great, Chris. And we've got that up on the screen here, and I'll send the link. In fact, I'll copy that link and drop it in the chat so that everybody's got it. And then we'll also be sending that around either later today or tomorrow for all those that have joined us today. One of the other things is, we'll step back over here for a second and kind of hit a little bit of Q&A, because I know there's always a few of those questions out there. One of the things that popped up was kind of this conversation around just broadband and internet access in rural Michigan, and obviously Connect to Nation Michigan has spent a tremendous amount of time looking at that and what can be done. And as COVID has opened the eyes of just about everybody to some of the issues that exist around connectivity, we're living in a relatively unprecedented time for broadband funding, and so the state as a whole is looking at what can be done, but one of the biggest barriers to the deployment and expansion of broadband has been money, and so for the first time for the first time ever, I would say, we're looking at what are the other barriers, because funding is likely not to be the biggest issue that we're going to run into in the coming years as far as expanding broadband. There are a tremendous number of programs. There were state and federal programs that have been created. And so, to say what the solution is kind of hard to put in words in the next 5 minutes necessarily. but certainly understand that based on the amount of funding that's been made available, the kind of programs that are being developed to help address connectivity, I think that, and I think Chris would agree, and a few other of our colleagues that are sitting in as attendees would also agree that we're going to make tremendous progress on availability of services all throughout Michigan and really around the country. That also includes programs that are going to help with affordability. Chris can attest to affordability being one of the top barriers to the adoption of broadband, and so helping alleviate and eliminate that barrier in rural Michigan will make a huge impact, even as to the access to telehealth and healthcare services. So Chris, any additional thoughts there around connectivity and the impact that you think we'll see in the near term here?
Right. Well, yeah, that is something that we heard a lot from healthcare providers, is that they have, these healthcare networks, they have spent millions of dollars on their internal systems, but it really is a frustration in that they have no control over the connections once they leave their property. And so whether that is talking about sharing data with other with other subject matter experts and getting second opinions, or sharing consultation with other healthcare providers, or conducting the healthcare interventions directly with the patients. They can spend and they can do as much as they can on their end, but without those good connections outside of their facilities, it's not going to help. So improving connectivity statewide, it's really a priority. Some people, or many people, considered it more of a luxury beforehand, but that is one thing about the coronavirus pandemic, is that it has really shown that good connections are really a requirement for everyone.
Thanks, Chris. I think that's all the questions we have. Are there any other questions? If you've got something, please feel free to drop it into the Q&A box quickly, or to even to raise your hand there, and I'll try to get to you. I'll go ahead and put our contact information up here, and I've got Chris's email there for you, and as well as my email and phone number. Certainly feel free to reach out to either of us with any questions you might have. As I mentioned, we will put out the links to the report and that website if you didn't grab it. I did put it in the chat box, I believe, for you to grab, but certainly we'll send that around. And don't hesitate to reach out to Chris or I with questions that you might have, and we'll be happy to try to respond. Chris, I want to thank you for taking the time to run through this, and all the hard work that's gone into putting this report, and ultimately the work that's gone into even prior reports and work in the telehealth field here recently.
Thank you for having me.
Yeah, thank you. With no other questions, we'll go ahead and close out today. We wish everybody a happy holidays, and we will talk to you again soon.
Thank you.
Goodbye.